We cannot let fear paralyze us in any aspect of society or in any aspect of our lives. We have to move forward with those activities that are necessary to give us the best chance to live a healthy and meaningful life. We've been dealing with this pandemic. We know what works. We know how to keep you safe if you have to leave your house and go get treatment. We are remarkably successfully actually preventing spread of COVID from caregivers to patients and patients to patients within our healthcare system. It is safe to get your care. The hospital and the clinics are a safe place to go. Please come get your care in a timely fashion. Prevention is so much more important than dealing with a problem when it's run its course. So get your screening mammograms, get your screening colonoscopies, all the things that you're doing in the cancer world to optimize early detection of cancer, continue to get it done. Please, please, please do that.
Absolutely. Who would have believed when we launched the Cancering Show over a year ago that we'd be talking about a real-life pandemic in Season 2? And I think for cancer patients, either in treatment or after treatment, it's a really scary time. I know for myself and my patients, and for many of you out there, social distancing makes it even more complicated to navigate daily life. Today, we have Dr. Michael Chang, the Chief Medical Officer for USA Health, to give us some perspective on COVID-19, where we are with the vaccine, and his thoughts on preventative screenings for those with cancer and other chronic conditions. Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Dr. Chang, welcome to the show. We're so excited to have you.
Well, thank you.
So we are here on Zoom today due to our friend, the COVID-19 pandemic.
Oh yeah, this is the way of life for us now. We've sort of taken the approach here at the healthcare system that this is something that's going to be with us measurable in months to years, not weeks to months.
You know, it's funny that you start off with that. We are circling around to COVID Part 2, the first episode in Season 1, and now really looking at what does COVID mean long term. For myself and my family, I agree. I think we finally realized that this is into 2021, if not into 2022. What about you and your family?
Yeah, I feel exactly the same way. And you know, the hardest part is maintaining vigilance because yes, it is the measures that have been put in place all across the country and that I hope we're all following, you know, social distancing, masking, staying out of crowded indoor areas, washing your hands frequently, and changing our behaviors, not traveling and those sorts of things can really wear on us. I mean, they're not typical to the American way of life. And so at some point we get to a point where we are really weighing risks and benefits every day. And that can be in and of itself emotionally and intellectually exhausting. And sometimes we find ourselves accepting risk that we probably shouldn't. And sometimes we find ourselves following proper precautions. But what we have to remember is that the virus is agnostic and does not care whether we're emotionally and intellectually exhausted or not. The virus is still there. And we have to be vigilant. We have to be resolute.
I think that's a great word. There are times in history books that we know about that people had to press on in times of great stress and endure situations that were, of course, worse than what we're going through now. But I do think it feels like a marathon, not a sprint, and something that requires more endurance and resolution. Helpful to know that it is normal to sometimes feel like taking risks and sometimes feel like it's not worth it.
Exactly.
Let's take a step back. Dr. Chang, as a trauma surgeon, how did you end up to be the chief COVID officer at the University of South Alabama?
Well, I think you just created a new title. Maybe there's an opportunity here, the CCO, the Chief COVID Officer, right? So as the chief medical officer, I'm responsible for a number of different things for the entire healthcare system, including the cancer center. I'm responsible for the quality of the care delivered to our patients. I'm responsible for the delivery of safe care. The difference between quality and safety is that quality is more of a subjective term or otherwise could be defined in several different ways, but safety is pretty simple, and that's prevention of harm. So as the physician that works with the administrative leadership team to ensure the safety of our patients. When the COVID pandemic first came to light, my first recollection of hearing about this disease was back in mid-January. We simply had to engage in the activities and the structures and the processes that we believe would need to be in place to provide optimal safety for our patients. In other words, preventing harm for our patients. I am a trauma surgeon by training, and I still take trauma call on a regular basis, but I've really enjoyed the opportunity to work on the structures and processes. Again, the idea being that if you have the right structures in place and the right processes in place and they're being followed appropriately, that your outcomes will be good. So in the safety from COVID standpoint, we put the structures in place to protect us from COVID and prevent spread. We incorporate those structures into appropriate processes. And what we expect to come from that is a very low disease transmissibility rate, and for our patients that do become infected to get better.
Well, let's walk through that. You talked a little bit about the precautions that we're taking at USA Health. I still remember the meeting where you told all of us that we were going to close the doors to entrances through, except for way in and way out, where we'd be screening at the doors, and we would arrange for drive-through testing, and it all sounded so foreign. And here we are, almost a year into doing all of these processes. How is USA Health doing?
I think USA Health has responded in a remarkable fashion for a couple of reasons. Number one, the people that work here are here for lots of different reasons, but in general, I would say that the folks that work here have a sense of mission, and that's why they choose to work at USA Health and in any aspect of our healthcare system. Number two, we are an academic healthcare system, and therefore we have the structure that is typical of an academic healthcare system. There are leadership structures, there are communication structures, and so on. But at the same time, we are a relatively small to moderate size healthcare system. So the structures and processes, the communication processes, the reporting structures, and so on that we have are more effective than they would be in a gargantuan 25 hospital healthcare system, right? And so we have the structures of an academic healthcare system, but we're not so big that we can't execute on what needs to be done. So it was a relatively simple process for us to identify the people on the administrative team and on the physician and provider leadership teams, to put them in a room or get them on a Zoom and simply use those structures in such a way as to communicate with all the members of our healthcare teams and our healthcare system. So, for example, when we knew we had to take action, we decided we were going to close the hospital to visitors and screen everybody by taking their temperature and asking them certain questions when they come in the door. We tell that to certain leaders within our system on the nursing side, the provider side, the physician side, and it just gets done because that's the way academic healthcare systems work. You're from an academic healthcare system with your training and background, you understand exactly what I'm saying. And so that really gave us an advantage. Secondly, we are tied with the university. And so the expectations set from university leadership, from President Waldrop on down through his team, through the dean of our medical school, Dr. Marimon, are all conveyed in a rapid fashion, and expectations are set, and there is an accountability that comes with being in an academic system where everybody in our system is accountable to the people that they report to. And so, again, those structures and processes really came into play and really helped us move quickly. I guess the trendy word is to say we pivoted quickly when COVID hit, and I think that's why.
I agree. I think USA Health did things that I haven't seen in my medical career. You know, the one that stands out to me was going from essentially no virtual visits to 100% virtual in 5 business days. I mean, I've never seen anything like that in my life, and so proud of what you have accomplished, what our leaders have accomplished, and to be able to continue to provide that exceptional care throughout all of this is really amazing. So when Dr. Scalisi and I met in season 1, and I think our podcast was probably the same day as that meeting, if I remember correctly. And so that just to take you back, there was a lot we knew about COVID, a lot we did not know. Can you talk to our listeners about kind of what are the newest things that we've learned about COVID maybe in the last 3 months that are really affecting how we deal with it within the health system and how people should, monitor their behavior in their regular lives?
Sure. Well, we've learned that number one, this disease is real. Number two, it's here to stay. Number three, that it's a sneaky disease. And, you hear a lot on if you turn on your TV or listen or listening on the radio or looking on the internet, you'll hear a lot of people talking about what could have been done different, what could have been done better, and so on and so forth. My response to that is that the biology or the nature of this virus and how it affects us as humans is so insidious that even the best put together plans executed perfectly would still this virus would still present us with major problems. Why is that? Well, some of the things we've learned that you had asked about are number one, a significant percentage of patients that get infected with this disease, with this virus, will never have symptoms or will regard those mild symptoms that they have as seasonal allergies or something bad they ate last night or something like that. And when a significant number, whether it's 10, 15, 20, 25% of patients that get infected never have symptoms, then it becomes very, very hard to prevent the spread of the disease. Number two, once you become infected, before you become symptomatic, you start shedding virus. And actually, an infected person will shed virus 48 hours before their actual first symptoms typically appear if they get symptoms. And the 48 hours before symptomatic onset is actually when you're shedding the most virus, and therefore you are at the highest risk of spreading the disease to other people. Number three, once you get infected, you can a significant number of patients will be asymptomatic for up to 5 days. Even if they do develop symptoms, it can take 5 days for those symptoms to develop. So those three things put together have made this disease a remarkably difficult one to manage for society, let's say. Furthermore, because the effects of the disease can be asymptomatic in a large number of people, mild in most of the patients that get infected, but life-threatening to, as we know now, tragically fatal to somewhere in the 1% range of these of patients, depending on lots of other things. It's again so difficult to track down and control, and it's also getting back to the first statement I made about it wearing us out. Some people might be at the point where they just say, you know what, I'm 22 years old. I can live with a fever for 4 or 5 days. I can live without being able to taste pizza for a week or so. I'm going out. And all those things put together make this virus so insidious that it's a monumental worldwide challenge for us to both limit, stop, or live with, or all the
Absolutely.
above.
Yeah. I think we see that in our lives, in the people we know who've been infected, in the situations that they've been infected in, that in our patients that felt like they were doing everything right except for this one event or this one thing. Unfortunately, my mom still says to me, you even said back in February 2020 that you didn't think this was going to be much because you compared it to SARS, you know. And I think we are all learning that COVID is unlike anything this world has seen before, you know, in terms of both that combination of being insidious and so severe in an uncertain group of people that, while identifiable, when you look at what those risk factors are, it incorporates a large portion of our society. So the question that I have for you, when we look at kind of things that our patients and our listeners really want to know, what have we learned in terms of treatment? How are we doing with treatment of those severely ill patients? It's different from what we knew back in 2020 in March.
So let's start with the severely ill treatment and work our way backwards to prevention, if you don't mind.
Absolutely.
Treating the most seriously ill, we've taken techniques that were cutting edge in the world of critical care, such as turning patients prone or lying them face down on the bed during while we're supporting them on the ventilator. Proning patients, we call it proning now. Proning patients or turning them prone for 4 hours at a time and then flipping them back on their back again is now commonplace and requires. It's a pretty resource intense way to take care of patients, in that to flip patients back and forth in an ICU requires a large number of people to be able to do that safely. But that's something we do. Proning works because it's sort of like when your nose is stuffy and you're trying to fall asleep. You lay on one side and you seem to be able to breathe out of one side of your nose, and then you try to flip yourself over and breathe out of the other side. And that's kind of the way proning works. We're doing that more. Number two, we are using steroids, low doses of steroids. These are not steroids that are anabolic steroids to build muscle mass or that sort of thing. These are steroids that mildly suppress the immune response to inflammation and infection. Low doses of dexamethasone, which is the steroid we're using, which is a common and cheap steroid, low doses of dexamethasone in the seriously ill patients have an important impact on survival and outcome and days on the ventilator. Next would be a drug called remdesivir, which is made by Gilead, which is a company that specializes in immune modulating drugs, is now commonplace. And we have a pretty good set of criteria or conditions under which remdesivir is indicated for administration. And then finally, well, we're using what they call convalescent plasma. In other words, we're taking the blood from patients that have survived COVID, that have donated blood, spinning the red blood cells out of it, which carry oxygen, and giving that plasma, what's left behind after you get the red blood cells out, to patients intravenously, and the antibodies in in that plasma they're receiving help to kill the virus in the patients that receive the convalescent plasma. Those are the four pillars of treatment in the critical care area. We've also learned a lot of other things, and that is that unless you require oxygen to breathe comfortably with this disease, you're probably going to be okay. The cutoff is between be okay to stay at home versus you need to come in the hospital is whether you need oxygen to keep your oxygen saturations above 90% or not. And if you need even the slightest bit of oxygen, you should probably be in the hospital for at least a short period of time. If you're coughing and symptomatic, but you don't require oxygen, in other words, your oxygen levels on room air are okay, you can be managed at home. So that's kind of starting severe and working our way down. And then on the prevention side, again, especially for your patients patients that are receiving treatment for cancer, it's so important to be vigilant about the things we can do to prevent spread of disease. Again, masks, social distancing, hand washing, and so on.
Great. Thank you so much for taking us through that. One of the things from the perspective of a cancer patient, it's got to be really hard. And certainly I see this in my practice, that fear of COVID. Battling cancer is hard in itself. Battling cancer alone or isolated, even harder. Decisions about should I start treatment? Should I attempt to wait? All of these things come into place. How would you counsel a family member maybe trying to make some of those choices?
What's the saying? The only thing we have to fear is fear itself. We cannot let fear paralyze us in any aspect of society or in any aspect of our lives. We have to move forward with those activities that are necessary to give us the best chance to live a healthy and meaningful life. We've been dealing with this pandemic. We know what works. We know how to keep you safe if you have to leave your house and go get treatment. We are remarkably successfully actually, preventing spread of COVID from caregivers to patients and patients to patients within our healthcare system. I haven't seen any comparisons across the country in terms of healthcare systems, but I can tell you from knowing what our internal results are that we've done a fantastic job of protecting our patients throughout this entire ordeal.
That's exactly what I expected to hear. That has been my experience, that we have done a fantastic job and that if everyone follows these measures, they do work because we don't see that transmission, despite the fact that we're all still doing our jobs in the hospital day in and day out. But you touched on an important point about folks feeling comfortable coming to the hospital and to the doctor. A news report recently talked about, that rates of visits for heart attack had gone down, although we don't think that all of the heart disease in the world got cured. Let's start with, just like we did with COVID, let's start with acute medical care and work our way down to prevention. What do our listeners need to know about coming to the hospital when you need the hospital?
Jennifer, coming to a healthcare facility in the United States now is probably one of the safest activities you can do because the CDC has done a remarkable job in leading the development of guidelines for safe care. For example, at our hospital and our clinics, we have a mandatory masking policy. It's not an option. No matter what your cultural or political beliefs are, you wear a mask when you come into one of our facilities. And we have been remarkably vigilant about enforcing that. And I think that's been a major player in why the transmission rates within our facilities is so low. We have modified the way you check in, the way your vital signs are taken, the way our physicians round on patients. Every aspect of physician to patient contact or staff to patient contact has been scrutinized and modified when necessary in the context of protecting the patient from disease transmission. So when you come in, some things will be different than they were, and if they are different, then you can take confidence in knowing that these are techniques that are proven to protect the patient. If they're not different, that means they've been evaluated and they're believed to be and known to be safe for the patient. So please do not put off acute care. Let's say you've got gallbladder pain. It is much better to go see your doctor and have your gallbladder evaluated and have your gallbladder removed surgically if necessary, before it becomes infected and dead, than it would be to put off that care, endure the pain due to fear of coming in the hospital, and then have your gallbladder perforate and become infected before you come in. The former, getting it done electively and seeking the care in a timely fashion, lowers the risk of having your gallbladder removed to almost infinitesimally small levels. Coming in when your gallbladder is dead and perforated, you have a high measurable risk of death and long-term disability from putting off that care. That's just one example,
Right.
and you just shouldn't do it.
And we know that's true across every disease type, whether that's a COPD exacerbation, cancer, of course, patients putting off when they know symptoms are concerning, and all the way to things like a urinary tract infection. You know, every patient that I've taken care of in the hospital this summer feels sicker and a week further in their disease than I would have seen last summer. And we just want the word to get out there that we want to see you sooner and that it's safe to come to the hospital.
Absolutely. I could not agree more. And I think what you just described is a downstream consequence of the concern about getting infected. But again, my message is, and all the chief medical officers in town have come together in a number of public service announcements to say, it is safe to get your care. The hospital and the clinics are a safe place to go. Please come get your care in a timely fashion. Prevention is so much more important than dealing with a problem when it's run its course. So get your screening mammograms, get your screening colonoscopies, all the things that you're doing in the cancer world to optimize early detection of cancer, continue to get it done. Please, please, please do that.
Absolutely. There's an estimate that 80,000 of those tests have been missed. And I can tell you as a GYN oncologist, and I know our surgical oncologists feel the same way, it is terrifying to us because we know those cancers are still there. But does that mean that the patient goes from having a curable disease to an incurable disease by the time they make it to us? So this is an urgent call to folks to come back in, to reschedule those appointments, to be seen by the doctor, to get the referral, whatever it is that you need to do to get that preventative care done.
100% agree.
Any last thoughts on COVID 2021? Where do you think we will be?
I have several thoughts. The first message that I would want everybody who's listening to really take to heart is to understand that we have to be vigilant and we have to do the right thing both for ourselves and the people that we love and care for. That means that do your part in protecting yourself, do your part in protecting those around you through mask wearing, hand washing, and distancing, and behaving in a responsible fashion. Number two, now that we have the vaccine, we can take on the challenge of inoculating not only the people within our health system, but the general public. And we're going to do this in a way that follows the guidelines from the CDC and the Advisory Council for vaccination processes nationally through our state health department. And that will be to first move into phase 1A, which is going to be healthcare workers, and then we'll move to 1B and phases 2 and 3. 1B will be essential personnel in the community and the elderly population. And as the vaccine becomes more available, we're going to vaccinate the rest of the population. It's going to be a major challenge, though, because we've got, 330 million people to vaccinate? So what's important here is that we all understand that the vaccine is safe. When we take the vaccine, we're doing it for the sake of our own health and the health of our family and the health of our patients. Finally, number three, our lives are not really going to change for a long time because the challenge is going to be getting this vaccine out to enough of our population that we can start to achieve national herd immunity. And that's going to take months. So in the meantime, we're all going to have to continue to wear masks. We're going to have to continue to social distance and be vigilant, even though we've gotten the vaccine, because we don't know yet if the vaccine prevents disease transmission. It probably does to some degree, but we don't know that. So we're going to have to continue the precautions that we've been taking. That means our lives will continue to be different. They will be different long enough that it will eventually be habit for us. We're in this for the long haul. And that's my message to everyone in the healthcare system when we have our pandemic task force meetings every other week or every month, is that we should always be looking ahead. There's a saying, Jennifer, that a good pool player is not thinking about the shot that he or she needs to make at the pool table right in front of them. It's the one that he or she is setting themselves up for the next shot. Or in ice hockey, it's not skating to where the puck is, but skating to where the puck needs to be. Our message to the healthcare system has always been, we have to skate to where the puck is going to be in this COVID world, and we will continue to do that. And you as patients should continue to do the same thing.
That's fantastic advice. I think we'll end on that. Thank you so much for being available on Zoom today. We really are great to know this information and to be able to give it to our listeners. We appreciate you.
It's an honor and a pleasure to be here, Jennifer. Thanks so much for inviting me. I really do appreciate the opportunity to get the message out.
Thanks, everyone, for listening to The Cancering Show with JYP, Dr. Jennifer Young-Pierce. Please subscribe, rate, and review this show on iTunes and anywhere else you listen to your favorite podcasts. Want us to deliver The Cancering Show to your email inbox? Contact us at cancering.com, and we can make sure you never miss an episode. We would love to know what you think about the show, or if you have any suggestions on topics you would like to hear. You can reach out to us on Facebook, Twitter, and cancering.com. Till next time, be healthy, happy, and always thriving.
This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.